Hello friends, welcome to our show. Today we are going to discuss about the problem of enlarged prostate in men above 50 years. And let me introduce Dr. Pradeep Mule, Senior Consultant Interventional Radiology, practicing in New Delhi, India. Welcome to the show, Dr. Mule. What is a prostate gland?
Prostate gland is the size of the walnut. You know, the walnut, exactly the similar type of the size comes for the prostate, right?
Okay.
And the prostate is located just below the urinary bladder.
Okay.
And which surrounded by the prostate gland. And these the tube which connect from the urinary bladder to the penis to pass the urine.
Right.
And the main function of the prostatic gland is to secrete the prostatic fluid. And this fluid is the very important component for a sexual activity also and for a semen also.
Okay. What is benign prostatic hyperplasia?
Benign prostatic hyperplasia, also called as a BPH also, and also called as a benign prostatic hypertrophy.
Okay.
This is a condition in which the prostate gland that enlarge. Normally this happens into the man after the 40 or maybe the age of the 50.
The elderly age.
Yeah, elderly age, this is a very common thing, right? When you see the childhood, like the prostate gland is very small, but in the due course of the time, the prostate gland that grows in a life twice. Once at the age of the puberty, that time the gland is start like at the age of 25, and then again they start enlarging the prostate at the age of the above 40 and 50.
Okay.
And most of the time, the enlargement of the prostate gland that won't produce any kind of the problems. But if this gives any kind of the enlargement, particularly very close to the tube which passes the urine, so that time they may get some kind of the obstruction.
Okay.
So during this time, in prostatic hyperplasia, they may sometimes get the low stream of the urine, and may sometimes they hesitate to pass the urine also.
Okay.
And because of the compression on the urethral passage, right? So bladder and neck also get the little obstructed. So urinary bladder that has to work little more to pass the urine.
Okay.
Right? So this is the benign hyperplasia.
Okay, alright. Why does benign prostatic hyperplasia occurs?
Till now, actually, no cause is found to enlarge the prostate. But a lot of research, they say that this is the aging process. During the age after the 50, the prostate gland start enlargement. But some researchers, they found that if a removal of the scrotum is done or a testis is done at the age of puberty, they don't get the enlargement of the prostate.
Okay.
So this may, I think, the influence by the testosterone hormone which is present normally in men.
Normally in males. What are the symptoms of enlarged prostate?
When you talk about the enlarged prostate gland, so there's two types of the enlargement is there. One is the generalized enlargement, as like a whole prostate gland is enlarged. In some people, there may happen sometimes only the one lobe which is called as the median lobe which enlarged. Whatever the type of the enlargement is there, if this gives the compression into the urethral passage, that is, the urethral passage is to pass the urine.
Yes.
If that get compression on that, this common type of the symptoms is the hesitation of the urination. When they go pass the urine in the early morning, the first urine pass, right, that may sometimes the narrow stream comes. It takes a little time to pass the urine. And once person is not passed the whole urine, right, so they may go after the 2 hour, 3 hour again. This is also known as the increased frequency of the urination. Sometimes some people, they feel that the bladder is totally filled and they may feel little like heaviness in their lower abdomen.
But they can't pass down their urine.
It's not passed also, right? But increased frequency, normally this happens in the daytime, but once this become a very chronic, so this may happen sometime during the night time also. In night time, they may go for a 3 4 times to pass the urine. Some are the 10 to 15% of the people, those are sexually active, they may get some sexual problems also.
Okay.
Like what kind of the sexual problem? They may get the erectile dysfunction also, and sometimes they may develop the retrograde ejaculation also. So what normally the semen has to come up through the penis, but that should go back to the urinary bladder. These are the common symptoms. Mainly when you talk about the symptoms, the hesitation, increased frequency, these are the two very common symptoms is there.
Okay, so mainly it affects the urinary problems.
Yes.
Okay, but how can an enlarged prostate be diagnosed?
For a diagnosis, once the man having this kind of the problem, they visit to the doctors.
Okay.
And doctors normally they do the digital examination. That is the wearing the hand gloves and put the finger into the rectum, because the prostate gland is very close to the rectum.
Okay.
So they can, by this technique, they can evaluate how the enlargement and other things are there for a prostate.
You can feel the swelling and all.
So this is the one manual diagnosis. And another one also there, the transabdominal or a transrectal ultrasonography also you can do that. Transrectal or a transabdominal sonography, which shows exactly the size of the prostate gland, how that defined and what the lobe is enlarged, how much the narrowing is there in the urinary passage. So this is the two techniques main. And if you wanted to know that nowadays a lot of people they asking for a magnetic resonant imaging also to diagnose the prostatic gland, because now the detection rate for a prostate cancer, which is the very good, the screening process and other things. So that's why the MR that gives the good clue, you can rule out any kind of the mass lesion or any kind of the cancer or something is there. Although the benign prostatic hyperplasia, which is not the cancer, this is just the aging process and enlargement of the prostate.
Okay. And I would really thank you to sharing this information to the people, because generally the male at the elderly age generally suffer from enlarged prostate gland and they look for surgeries even. But looking at your episode, they will be relieved, I'm sure. Thank you.
Thank you very much.